Who will give the rule on moving the slides? Me or you?
The team will move the slides for you.
Okay. First, thank you for introducing me. I first want to present myself. I am a physician and a clinical pathologist from Alexandria University. Recently, I'm affiliated to Jouf University. This presentation will talk about the role of female sex hormone and inflammatory cytokines in relation to occurrence of abortion in toxoplasma gondii infected female. First, we will talk about the importance of toxoplasma gondii infection. Toxoplasma gondii is an obligatory intercellular protozoan that affects human and other warm-blooded animals. During pregnancy, toxoplasma may infect the maternal side of the placenta in the course of acute disease, and the fetus may become infected. The transplacental transmission of toxoplasma to the fetus usually results in fetal damage or abortion to a degree depending at the gestational age at the time at which the infection occurred. Thus, it may lead to variable outcomes like miscarriage, stillbirth, or congenital defect. Next slide, please.
Just a second, Mona. It's just
Okay.
technical. Apologies for that. Can we move on to the next slide, please? Or maybe start a slideshow and then we can move on to one.
If you could give me the rule to share my presentation, it will be okay so that I could go on without wasting time.
Yeah, let me just check with the team. Just
Okay, please. Okay. Now we are moving to the next slide. We are talking about the epidemiology of Toxoplasma gondii. The prevalence of Toxoplasma gondii in pregnant women varies between countries, where it ranges from 9% to 67% infection in Europe, and it ranges from 0.8 to 28% in Asia. In Egypt, the seroprevalence is different between different governorates. The highest protected form was 67.5% of pregnant women, while the lowest percent of affection was found in Alexandria Governorate, 12.9%. Here, now we are going to come to the main rule of our study. We studied the role of the female sex hormone estrogen and progesterone. We all know that estrogen and progesterone are female sex hormone that have many primary and secondary effects. In our study, in addition, it was found that estrogen is implicated in many other systems, including immune system, skeletal and vascular system, and endocrine system. Progesterone also has a serious function in many tissues not belonging to reproductive system, like the mammary gland, breastfeeding, cardiovascular system, central system, and bones. The inflammatory cytokines like interleukin-12, interferon gamma has inflammatory rules in abortion, in occurrence of abortion. Interleukin-12 was previously known to play a role of a T-cell differentiator or natural kill stimulatory factor. The secretion of interferon gamma increases the phagocytic activity of macrophages and cytotoxic activity of CD8. It was found that cytokines, interferon gamma, interleukin-12 cause abortion in pregnant mice and produce nitric oxide, which kills the toxoplasma, intercellular toxoplasma infection. Our study aimed to find the role of female sex hormone, estrogen, progesterone, and the two inflammatory cytokines, interleukin-12 and interferon gamma, with the occurrence of abortion in toxoplasma infectant cohort group in pregnant women in Alexandria. This study was conducted in Al-Shab University main hospital on a cohort of 150 pregnant women aged from 20 to 35 years old. This was a case control study. The group of women enrolled in the study was divided into three groups. The control group who were negative for toxoplasma infection, 50 female groups. The second group was the pregnant infected group, which were positive for either IgG or IgM or both antibodies for toxoplasma infection. And the third group consisted from 50 aborted women who were positive for either IgG or IgM or both toxoplasma antibodies. The result of the study showed that upon studying the distribution of the degree of positivity of toxoplasma infection, the recent infection or acute IgM infection formed 8% of the pregnant infected group and 50% from the aborted group. The chronic infection IgG formed of 72% of the pregnant infected group and 30% of the aborted group, where both the subacute infection, both IgG, IgM positivity was positive in 20% of both groups, pregnant or aborted groups. Upon studying the hormonal levels variation between the study groups, it was found that estrogen was the lowest in the toxoplasma aborted group. The level was 547.5% picogram per ml, although it was less than double the levels in the control and the pregnant infected group. However, it did not reach the level of significance. The progesterone level was almost the same in the three groups without any significant difference. Upon the determination of the level of inflammatory marker among the study groups, it was found that the interleukin-12 was highest in the toxoplasma aborted groups and significantly higher than both groups, the toxoplasma control group and the infected pregnant female group. While the interferon gamma was also the highest among the aborted group, significantly higher than the control group. The correlation studies found that there was significant negative correlation between interleukin 12 in relation to progesterone in the pregnant infected group. And it was positively also correlated, interferon gamma was positively correlated with estrogen in the infected pregnant group. Interferon gamma was also positively correlated with progesterone in the pregnant infected group. Regarding the correlation in the whole infected groups, whether the pregnant or the aborted, there was found a positive correlation between interleukin-12 and estrogen. There were no any significant correlation regarding the study parameters in the aborted group. So our study concluded that it supports the role of estrogen progesterone. They may act as an immune regulator effect through acting on immune inflammatory markers with protective effect against abortion due to toxoplasma. Progesterone may have protective effect against toxoplasma infection, as it showed a positive correlation with interferon gamma in pregnant infected group. Estrogen progesterone effect on immune modulation was not profound in the aborted group. At their level, didn't show any significant difference. We recommended further studies to be studied on more large population to establish the role of progesterone and estrogen as immunomodulatory against occurrence of abortion in toxoplasma infected group. Finally, thank you for your time.